Hello, everyone, and welcome to AZ Health Zone, Arizona's SNAP Ed program. I'm the AZ Health Zone Community Nutrition Specialist, and one of my roles is to help support and provide technical assistance to those of you who provide direct education in our communities. This video is an overview of all things you need to know about direct education. This video will cover the key concepts and approaches that guide our direct education work, discuss what direct education is, including the navigation of our website's tools and resources, and the support and technical assistance I can provide you as your specialist. At AZ Health Zone, we believe direct education is more than just teaching participants about the benefits of eating nutritious foods and being active. Our education efforts are combined with policy, systems, and environment changes, PSEs, in our program's three focus areas: active living, childhood, and food systems. This may look like facilitating direct education lessons at a summer food service program site, community gardens or parks, or a farmer's market site. By providing multiple levels of nutrition and health engagement programming, we believe we can support positive health and wellness for communities, families, and individuals. We aim to use the principles of trauma-informed approaches, community engagement, and health equity as a foundation for our work, and to honor and see members of the community for their whole selves. This person-centered approach to education allows us to better connect with community members, provide education and programming that is meaningful to them, and support positive behavior change. So, what is direct education? Direct education is approved, evidence-based nutrition education or gardening lessons that actively engage participants through live facilitation and/or interactive multimedia. Whether you are in a classroom, Zoom room, or anywhere in between, centering the learning process around our participants, involving them in the lessons, and creating a safe space for thoughtful discussion are all great ways to actively engage using a person-centered approach. When it comes to using approved evidence-based curriculum, you can find the full list of our approved curriculum and more details on our AZ Health Zone website. Let's take a look at the website to learn more about the curriculum offered through our program. When you go to azhealthzone.org, you will see a section of the website we like to call the Collaborators page. On this page, you'll find information, resources, and tools to help guide you through your work at AZ Health Zone, from operations and management to the three focus areas, and of course, direct education. When you click on Direct Education, you can find a document called the FY21 to FY25 Approved Curriculum List. This has all the approved curriculum for this current grant cycle. Please note that this information is subject to change throughout the grant cycle and as we enter different grant cycles. Any updates to the approved curriculum list will be announced and changes will be reflected on this website. Now, we'll take a look at that approved curriculum list. This list provides the names of the curriculum along with a link to the curricula's website, intended audience, and a brief description of what the curriculum is. The audience section is important because the curriculum has been evaluated by curriculum creators specifically for that audience. If we, for example, teach a pre-kindergarten curriculum to a second grader, we are not meeting the fidelity of the curriculum that it was intended to be taught. Curriculum fidelity must be maintained in direct education in order to provide evidence-based interventions. Going back to the part of the website that has all the tools and resources that are necessary for direct education, you will see more information about all the approved curriculum. This section gives you more details about the number of lessons, the length of time for lessons, which languages the curriculum is available in, cost if applicable, and other implementation and evaluation guidelines. Other tools on this section of the website are resources that may be helpful to use in addition to your direct education lessons. It's important to note while these resources come from reputable websites, they are not considered direct education. For example, if you wanted to create a short video or class on food safety using some of the resources you see here, this would not be considered direct education. This is because they are not an approved curriculum. When you think direct education, think approved curriculum list. Other classes or videos that provide nutrition or health information can be classified as an event. This is not an exhaustive list of resources that you can provide your community members with. Feel free to use reputable sources with your communities as you see fit. However, just remember that providing a resource is not the same as providing direct education. For example, on the left side of the slide, you will see a handout from the Academy of Nutrition and Dietetics on slow cooker meals. And on the right side, you will see the Leader's Guide to our curriculum, Eat Smart, Live Strong. While these are both found on the AZ HealthZone website in the Direct Education's Tools section, only one of these is direct education. The slow cooker handout could be a great resource for your community. However, it is not a curriculum like Eat Smart, Live Strong. Thinking about our concept of having person-centered work at AZ HealthZone, you might be wondering, how can you make an approved curriculum fit the needs of your community members? With our 3 guiding principles and the direction of AZ HealthZone, we consider evidence-based practices and interventions like direct education to include not only the research, but also incorporating community lived experiences and facilitator expertise, which could be recognizing the capacity of your skills as a facilitator and your experience as a community leader. To provide the most relevant, meaningful, and positive health engagement messages, we realize that sometimes there needs to be adaptations or modifications to the curriculum we're teaching. Curriculum modifications to be more person-centered, trauma-informed, or culturally responsive are allowable. This could look like adding culturally relevant food or example scenarios into lessons, incorporating mindfulness activities into lessons, and not reading the curriculum word for word to allow for better understanding of the material and to avoid the use of unhelpful language. For more information on allowable modifications and helpful versus unhelpful health messaging language, please review the AZ HealthZone Guidance and Policy Manual and the Language of Health Style Guide. Other modifications you'd like to make to the curriculum will need to be approved by myself and the rest of the state implementation team before putting into effect. Modifications that are not allowable are those that change or lose focus of the curriculum's main objectives. These changes could interfere with curriculum fidelity. If you are wondering how to know if a curriculum modification you would like to make is allowable, unallowable, or somewhere in between, please reach out to me. Talking through curriculum modifications is just one area of technical assistance and support that I can provide. I can also help you get registered in curriculum trainings if applicable, attend or observe your DE lessons, connect you to other local agencies doing the same work, and facilitate group discussions or professional development opportunities on person-centered direct education best practices. At AZ HealthZone, we value co-learning, co-creating, and collaborating. One of the best ways to do this is at a committee or working group meeting. Our DE committee is a wonderful opportunity to ask questions and brainstorm answers to difficult questions. It can be frustrating to not have a clear answer to some of the questions, but talking through the challenges together is the most inclusive way to make sure everyone's voice is heard. Please view the AZ HealthZone Professional Development Calendar to see when upcoming meetings are scheduled. Thank you for your time and interest in watching this brief overview of AZ HealthZone Direct Education.